medications to the hypoxia and acute signs that is curiosity in the stage. Then there is because it landed into restriction. So curiosity is indicated as mechanical representations. Hypoxia is indicated that is it will get total patients of 50 to 60% will get like the resistant form. And this problem will come and cause the problem of hypoxia. What is the definition of hypoxia? Well, increase in the tissue level. Everything is the hypoxia. Oxygen level percentage of having plan for acute to go up till of around 8 feet. Right? So you will on the first day, husband try to reach about 8,000 feet. First day, right? Then your question is, what will be your outcome of this will? What is the outcome? The outcome of it. And the pathophysiology even question to related on pathophysiology of those outcomes. So let's say that a patient at the patient program, 30 years ago, a patient can participate of his got the 8,500 feet, right? Against 8,000 feet over the world. So what are the outcomes? Already is done. What are the outcomes? What is the outcome? What is this? Compared to many versus outcome. What is the outcome? Key word is first assembly. It goes up to the first day of the and acute mountains then after the accident or higher acute cerebral up higher acute pulmonary injury. Able pathophysiology is pathology. How can you prevent this? What are the medicines you can use? What are the medicines and prophylaxis? So, prophylaxis is the way to prevent the acute pulmonary disease. Keep doctor and as well as cerebral edema of the higher cerebral acute pulmonary sickness, higher cerebral edema, higher pulmonary. What is the pathology of the white color last page? What is the pathology of higher pulmonary? Another thing, pathophysiology of pulmonary is a higher What? usage is there. Like the business constitution cannot be changed. That's why it Starling's law. Starling's law means force. Starling's force means Starling's high pressure to the state. So it's compounding this is practice hydrogen survival. You want to do out this is causing the country. That the anemia pressure change is not. Right? Now the second part that is prevention. Acetylcholine. Acetylcholine because acetylcholine is causing the metabolic acidosis, right? And our respiratory application is going on in case of active problems and what are the symptoms of hepatitis? What are the symptoms? Unconscious anemia. Again, we will two spectrum of I am going to symptoms here. Clinical features. After subject is years later, when after also after fear, the first symptom is activity changes. I would say activity is developed to I know they will not know. What I will not do, I will say that not. They will do whatever. I will say that not. I will say that not. They will get started. They will say that you. Silver is not over, silver is not. Active movement is not the silver. It is higher than silver. Correct? You are right. Dizziness is there. Abdominal pain. Vomiting is there. I have unconscious because there is sleep problem. No problem. Attention. While active problems also prevention that will come down. Injury has to increase the figure also. So in these cases, a lot of people question how to do it. There are symptoms that are also subject to the arm to the question. Therefore, normally, anyone can say that it is not starting to so that is a problem in our pressure hypertension, that is the infusion of the fluid, say and how it is the first thing and there is a severe headache that is not controlled by the anesthesia. Headache will be not. That's a no. You need to divide. That's a no. Not a problem. And that's headache to the instantaneous pressure. In the activation of the cellular, the pattern is the instantaneous pressure. That's why the renal is not normal. You need to high or need to stable in unconsciousness, ataxia, very important. And also headache is also very important. And at a certain height, due to the increased intracranial pressure. That you have to do the intracranial pressure. Okay. Now next one is our steady or stagnant atmosphere. What does it mean? What does it mean? Stagnant means what does it mean? Stagnant means stagnant means last solution for that. That oxygen has into the for that. One of alveoli. করে ধরে আর এখানে হচ্ছে নন ক্যাপিলারিজ পালমোনারি ক্যাপিলারিজ এখানে পালমোনারি আর্টারি এই এরিয়াগুলো ক্যাপিলারি আছে এখানে whether it is exchange inside the capillary and then it is pulmonary vein তাহলে এখানে pulmonary artery এখানে pulmonary capillary and this pulmonary vein right ঠিক কি আমাদের পাই এদিকে অক্সিজেন ই অক্সিজেন এখানে আছে এখানে কার্বন ডাই অক্সাইড ওকে কার্বন ডাই অক্সাইড এই রাইট সো এটাই আমাদের পাই যার সিস্টেম বলছি আলটিমেট কাজ কি এটাই আমাদের যাতে আমরা ভেন্টিলেশন এন্ড পারফিউশন করতে কি হবে এটা আমাদের কাজ এবারে আমরা যদি দেখা যায় যেমন হাইপোক্সিয়া ইজ স্ট্যাগন্যান্ট অর স্টিল দ্যাট মিন্স ব্লাড সার্কুলেশন is not going to stop তাহলে আমাদের এই যে দেখেন আছে আমরা তাহলে যে পরিমাণ ব্লাড will not miss right that is proof তাহলে amount of blood here is coming from the diffusion is this that's important amount of releasing release the pure of release that is what we have there it's a for example here at the couple ঠান্ডা দিন আমি যখন একটা বেশি দেখতে একটা বাচ্চা থেকে আমি কিন্তু বলছি ট্রেডে লাইফ শুরু ওরা সম্ভব হয়ে তার মধ্যে এক্সেস করতে কোনো অ্যালগোরে তাহলে ভালো আছে শুধু এটা ভালো সাপোর্ট আমাদের আজ ফিরে বা কারিগর করে যাবে কোনো কারণ কি ধরনের কারিগর করে যাবে ওরা বিহারে আমরা কারিগর কেউ কারিগর বিগত কি হবে the scope of the program and that is the cardio is this now you see area of right right population of it carbon calculation then right and then carbon calculation and then is coming the pulmonary artery as a pulmonary right and then is coming the pulmonary capillaries for the exchange and then coming back as the pulmonary vein and this pulmonary vein will come to the left atrium then vertical oxygen block then it goes to the circulation a circulation the way it is cardiac is the duty is cardiac is the pump to pump it gets very lot of this and obviously the pumping amount of blood is current was going on with stagnant hypoxia or hypoxia yet he applied the tissue at our body that is more from history that means if 2 minutes lack of oxygen happens then it will be ischemia if is prolonged that was a process আমাদের বডিতে কোন কোন সেল বড় হ্যাঁ একটা সিরিজ মানে ব্রেন সেলস these are the more important for the exchange so anyway you have to push the blood to the brain আপনি যদি 2 মিনিটের মতো অপেক্ষা করেন তো সেটা যদি blood না যায় that is not common damage যদি চাইল্ডের ক্ষেত্রে আবশ্যক that is called parental asphyxia asphyxia আছে কি আছে human normal after the blood normal right now that is called parental asphyxia what does it mean abdomen why do we have because in the abdomen in the uterus mother the baby full of water in the mouth after the abdomen the first cry water will be dislodged water will be dislodged and air will enter if he or she directly cry you anything very stress you think that water will be dislodged no so that's why if lungs cannot form or lungs cannot inflate then how can you expect that the exchange there will be no exchange at all there will be no blood exchange during this period so at that time permanent damage and that is one of the second cause our other institute debating what we operate so the market and usually the baby was very stressed Illustrative. That is the cause of perimeter aspiration. Aspiration is means what? Just difficulty of breathing. That is the aspiration choking. Aspiration here is not just the physiological to make the choking down. What is the one that after years there are first lot of people choking. Choking is difficult. But I have seen many patients choking in mind. After you do the rest, you do the injury of rice, dal, they have solution that you are going to and diet you guys will share it and have finished. Now, this is just an idea on the immediately we use immediately right? So, this is your stagnant and your receiving hypoxia. Important was harmonic embolism and heart failure. We can say two causes are there. Okay? Now comes the anemia. Anemia. Anemia means what? What is the definition of anemia? Anemia. What is the definition of anemia? Now what do you do? Evidence of hemoglobin very hard to hemoglobin is oxygen carrying right? Anemia means what? Hemoglobin is and also your oxygen carrying capacity. Our own oxygen carrying capacity is now oxygen carry hemoglobin carry that is not meant. That is why is so bad? Why is so bad? For carrying oxygen. If this is class 3, there is a not. In case of methamphetamine, it is class 3, so it does not carry anymore. So that's in this way. Our active are playing what is the meaning of positive? Positive to operative and mass is carbon. That is the lower what do you mean? You want to choose chocolate or chocolate? Already know. Here, conformational changes actually that causing the conformational changes so that opening the other sides of the hemoglobin so that second oxygen can bind and second oxygen binding again is opening up that the conformational change is happening so the third oxygen will enter and then fourth that is what positive hemoglobin and in case of methylmalonium that is this the positive hemoglobin will be a carbon so anemia hypoxia means what pure hemoglobin pure hemoglobin blood surface hemoglobin either the abnormal or hemoglobin structure of the or an abnormal structure of the hemoglobin. These are the five. The anemic hypoxia means there is a lack of total hemoglobin. and so that we can carry the vaccine. The carry the production. Suppose acoustic anemia. What does it mean? Acoustic anemia. Anemia. One of the acoustic. Okay, we will study. Now, we will study lymphoid cells and myeloid cells. Whether myeloid cells will be the reaction or platelets, all the terminal myeloid cells. Another set of lymphoid is nucleocytes. They are one. Then RBC will come step by step, and then RBC will come. If any acoustic anemia is there, that means fail to increase or production of RBC. Production of RBC is this. You will the hemoglobin will be much more known. After RBC will be potato. Okay. That day they receive hypoxic swimming pool for material extra swimming pool একটা আবিষ্কারের থাকে কত লাগে 250 বিলিয়ন হ্যাঁ মোট একটা আবিষ্কার রাইট আর একটা হিমোগ্লোবিন চারটি মলিকিউলস অফ অক্সিজেন মানে একটা আবিষ্কারের মধ্যে কত না 1 বিলিয়ন অফ অক্সিজেন তাই তো 1 বিলিয়ন even is this whatever drastic probability. That's why in RBC formation is happening. Not only that, it is a single anemia. So structural. That is also important. If it is physiological anemia, that is that hemoglobin, right? A single cell anemia, hemoglobin is half that money. So physiological money, right? So these things. Abnormal structure of hemoglobin, abnormal formation of oxygen, lack of formation of oxygen are the main important causes of anemia. Right? Anemic hypoxia are the area that carbon monoxide poison. And what does it mean? It is a system. But it is right? So, carbon monoxide is 20 times higher as affinity for the heat. Affinity for the hemoglobin is basically the oxygen. So, the carbon monoxide is a constant nutrient, right? It has not nutrient oxygen. This is carbon dioxide may be the proper enter and that will cause the enter gas. In that will continuously be filtered out because it will not come. Because the partial pressure will always be there in the because partial pressure is limited by the concentrations in the reserve form. Reserve form is after the say এটা আমার কম্পিউটারের সঙ্গে এটা আমাদের আবিষ্কার এই আবিষ্কারের মধ্যে প্রবলেম সেখানে অপশন আছে সেটা আমাদের কম্পিউটার না রিমেম্বার অপশন ইজ ক্যারি only 1% the result of rest 98-99% to oxygen form right so that there is a law that is called oxygen distribution law the so it is a sigmoid law AKPO2 or AKPA KD hemoglobin percent saturation hemoglobin percent saturation what does it mean basically আমি পার্সেন্ট কোন দিকে কত পার্সেন্ট আছে কত পার্সেন্ট এটা হচ্ছে হেমোগ্লোবিন পার্সেন্ট এটা কত মিনিট হবে একটা তাহলে খুব বেশি কিছু পারবে যদি find out the ratio 10, 20, 30, 40, 50, now they are going to be 100, and then also it is also 10, 20, 30, 40, 50, simplify this curve. This curve simplified that when the requirement of the oxygen to the hemoglobin has to be unbound their oxygen. And you समय ऐसे जब चाहे suppose for example human fetal hemoglobin the oxygen is normal hemoglobin means hemoglobin right mean A1 then alpha 1 beta 1 is common R plus order fetal hemoglobin alpha 1 common remember 2 3 what do you do is coming from likewise is coming should A1 mata 2 3 black is coming and the affinity for the 2 3 because of fetal is much more or less much more so that it cannot release oxygen so the काम को ले तो किसी को माने आप और आप ना ये आप और आप हम जो राइट साइड पर there around doing after there will be simple on the right side there will be and right of release what release oxygen release right means right side release only on the wherever the need of oxygen to release then the oxygen of the oxygen that is what I say and fetal hemoglobin will be like that. That is left shifting because the left shifting it will not unbound. Correct? Hemoglobin, oxygen, carbon. It will not release oxygen. No. It will not. There are some factors are there. There are some factors are there. यदि हम percentage of oxygen action को बढ़ाते हैं क्या बोलना 8% है स्टिक portion का टिश्यू है और 8% का चलते लंग्स ना समझे ये है एल्वियोलर की हो जाए our actor को one time pressure this means 95% of our when हमारे percentage है ये जो variation है more or less 95 CO2 is 95 millimeter and this pressure saturation is 100%. Saturation, the way is around. That is not nothing. Similarly, if the left side is there, left side is what is taking the oxygen, but not further. We distribute the oxygen short time. I want to distribute the oxygen time. That side is stable. That is not good at all. That patient is not in his hands because of these changes of this oxygen saturation. So in these cases, you have to give one of the factors which we call the right side. Oxygen becoming lung. Say something to our right side. Where are we? Are we in our hand? Hello. He is going to class. That means PCU is PCU temperature. This is called a right left side. So this is called oxygen hemoglobin dissociation curve. As the dissociation of the dose, that would like to arm energy. That would be a mission. Now, left side is dissociation. Left side, the curve is to the left side. And that is the unbound position. Bound where एक घंटे आपके hemoglobin oxygen छाड़ने, और एक घंटे आपके oxygen छाड़ने, আমার ভালো দিক হচ্ছে রাইট সাইড in many problem of your body diseases or any drugs you need to reduce oxygen in the nearby tissue so that you can get oxygen immediate metabolic activity everything mitochondria electronic structure change and the electronic this is happening so oxygen levels charge respiratory system is going on you have to take CO2 at the permanent level 95%. And the tissue level is equal to that's why I feel to know you it is going inside the tissue and the not coming out from the tissue for the mouth. Tissue level tissue level 45 but I say 40 so it's happening and again difference is here again O2 is faster pressure 104 and there is 40 then this is coming down and now this is 45 over 6 on inside is 40 so pressure high here from the down in that down now histotoxin what does it do histotoxin what does it do histotoxin why histotoxin tissue level what that's it oxygen common তারপর stagnant হচ্ছে তারপর anemia then there is a ratio sin 8 by and the values sin কি হবে বলে তাহলে না how sin measure happens বলো কেন একটা ইঞ্জিনিয়ারিং নাম হচ্ছে রাতে ও ইঞ্জিনিয়ারিং সাইকেল অক্সিজেন ফাংশন ইজ to take electron from the electron chain and so that we form a right we sacrifice and the system of that we even know that we will not form at all we will not take any oxygen we will not take any electron to form the anemia that is called hypoxia but I remember that examples hypoxia একটা কি ventilation confusion problems or mismatch high altitude and then any pulmonary diseases especially obstructive and restrictive pulmonary disease or freeze then coming to the stagnant or dystonia pulmonary hypoxia or congestive cardiac then anemia means any type of anemia that may be neurologic anemia sickle cell anemia hypoxic anemia any anemia may cause hypoxia so you know অনেক কিছু তো জানাতে পারি patients having some respiratory problem after walking through distances and then general survey any patient you have to go for the heart function as well as general survey any patient all the patients so when you are doing general survey when you put down this area you will see the pain so you will keep in mind that only this pain may cause such type of respiratory problem keep in mind how is clear that is oxygen if you give if I do suppose if I do what does it mean by what is the full form of hypoxia fractional inspirated oxygen এটা এখন এখানে কত আছে হ্যাঁ কত আছে বল হ্যাঁ 21% আমি ওদের এই যে চলে গেলাম ক্যান্সার চলে গেলাম সেটা কত হবে হ্যাঁ সেম আমরা চলে গেলাম ইয়ে দেখো so percentage of oxygen is same whatever you want but pressure is changing partial pressure is wrong. That's wrong. And it is wrong. And this body is there. That is the concentrations of percentage of oxygen is given out of the number of molecules of oxygen, not the percentage. So number of molecules is decreasing going to zero, not the concentration. So we want percentage. So that concentration molecules number of molecules of oxygen, pressure, partial pressure of oxygen will be less in case of iron. Right? Like any type of anemia treatment not starting. But should be to provide much more answer. Is visible. Oxygen hemoglobin dissociation number mostly diagnosis. So in this pattern, we can change the values. So any patient due to anemia with restrictive hypoxia due to oxygen deprivation. Oxygen is useless. Why is it? That one is to hospital. The saturation of data is watching. 85, 88 is still like oxygen gets to critical down. Huge oxygen. 100% oxygen, 100% PV. The saturation is talking. Why? Because oxygen located in the oxygen and lead resolution is important. Oxygen-hemoglobin dissociation graph is important. This means important for your full syllabus for the Now, question is what to do by science. After missing the science is another division, let's take it out. And science is clear. What to do by science? What to do? Blue color, because blue color में हमारे पास ये वाला हाँ बोलो blue color का क्या है हमारे बोलो peripheral কোথায় দেখো IST সেন্ট্রাল কোথায় দেখো লিপস ডিপার্টমেন্ট চাপ তার আগে কি করে তার নাকে টিপ fingers toes finger toes there is a patterns and the capillary there is a dark is reduced hemoglobin and this reduced hemoglobin first of all absorb two lines from our surrounding mind that is a green and red but it come out as a wavelength of the red disease and I want red green and red absorbs it absorbs green and red color but whenever it is reflecting it is our wavelength of the blue খুব পরিমাণ ওয়েভলেন্থ যখন হচ্ছে রেডিয়ান দিয়ে সাউন্ড দেওয়া কেন দেখতে পাচ্ছি না কারণ reflecting as a ray as a wavelength of the ray that's why my eye is saying here yes it is red blue is white that's why the reduced amount of reduced the blood content the reduced hemoglobin that absorbs first red and green color and then is reflected as wavelength of the blue color that's why is our blue right now central and peripheral science is very much important why important peripheral science is the other by suppose একটা পেশেন্ট আমাদের পাই আছে স্যার নিউমন বেবি 3 দিন আছে এটা আগে জাস্ট ছুটি হয়েছে বাড়ি গেছিল নিয়ে স্যার পাঠ্য নিয়ে আমাকে বলতে না তারা বলে আমি ওকে একটা জিনিস জানাবো স্যার ইমার্জেন্সি কেস আর যেটা দুটো দরকার আছে আমি জানি কারণ পেশেন্টের এটা বলা হয় অ্যাপ্রোচ অ্যানালিসিস পেশেন্টের পুরো সাপোর্ট করে ভিডিও কথা আছে আর কি কেন বিকজ অফ ফুড এক্সপোজার তারপরে বাচ্চাকে অ্যানালিসিস করে রাইসে পাওয়া না that was the active science that বলা হয় active science right active science it is benign it is totally benign so most of the cases in case of peripheral only the peripheral science is there most of the cases are benign due to the vasoconstriction ঠান্ডা দেখি vasoconstriction কি হয় বা ডায়গনস্টিক কি হয় আমাদের কাছে and that's what the that is not active science but in case of central science central science means what it's lips abdominal tongue because এগুলি তো বলেছে আমার বাচ্চা দুই ধরে জব নিয়ে আমার বাচ্চা দুই সমস্যা নেই বলে আমার কাছে আমি ইউনিভার্সিটি hospital mainly that main patient takes away from his arms. What does it mean? What do you do? Sound about palm sound about no sound about after position head space after position head space during the space activity examination of example of structure structure ventilation is very good we are taking what is the outside and so very good apparatus on there so ventilation is good but oxygen is not good that is called head space but if the ventilation is good oxygen is good that is called sharp there is what good satisfaction unfortunately by this fact actor who was in the population Oxygen কি হবে কি ফর কি আর পারফিউশন প্রেজেন্ট ventilation action that's also and sound very like to listen that will like to listen I believe that কোনটা বেশি হবে এই হয় chambers and then here এটা আমার রাইট এটা রাইট এটা লেফট এটা রাইট এটা রাইট তাহলে কোন দিক দিয়ে স্নান বেশি করা কথা মানে তো সাপোজ এখানে কি করে এটা ডিএস হলো কি বলা হয় ভেন্ট্রিকুলার সার্কুলেটর রেট তাহলে কোন দিকে যাবে রাইট দিকে যেতে হবে হ্যাঁ রাইট দিকে যাবে ফার্স্ট দিকে যাবে নাও বলে নাম কেন pressure is much more high in the left side but blood flow ज़्यादा तो hypoxia के लोग इससे yes they is developing he develop होते ultimately pressure is increasing here it is left ventricle if left ventricle pressure is increasing then left ventricle has to pump much more process the process are missing from pressure area এটা হতে কি হবে রাইট ভেন্ট্রিকুলার কি হবে রাইট ভেন্ট্রিকুলার if right ventricular hypertrophy is there and then it is causing the higher pressure now then it will reverse from here ultimately deoxygenated oxygen production and that more presentation to your central side এই লেফট টু রাইট করছে দেন রাইট টু লেফট করছে এটাকে বলা হয় আইসোমেট্রিক সিনড্রোম আর এর নামটা হলো আইসোমেট্রিক সিনড্রোম ERSS আইসোমেট্রিক সিনড্রোম আইসোমেট্রিক সিনড্রোম তাহলে ভিডিওটা হচ্ছে রাইট টু লেফট সাম আইসোমেট্রিক সিনড্রোম So sinuses may cause for the scientific reasons any patient who are dealing with especially in children hereditary any patient who are dealing with central sinuses they have to think about whether it is real thing there or the problem now I know to here tetralogy of Fallot diastolic anesthesia gas position of blood vessels it is of these these are basically are shining and also period of the accident syndrome just if you write scientific material was the right to the science is important for science especially central sciences that is enough that's it so any patient these discolorations of the leaves mucous membrane and your tongue, especially tongue in front of the tongue, that especially suffering from hypoxia. Definitely suffering from hypoxia, definitely not important for the sign. And sign means what? Sign means confusion is there, so oxygen and cellular missing. After some of the other to get it, I have a this one also because of this too also everything this too so the man whether the target is to on this something that knows something from the body due to this one exactly the restriction on body there is a clinical application of this. So sinuses is our next phase syndrome and that is alarming. That is highly alarming because we have to detect the cause as early as possible. Because if this something is not there and something is important to this something that the oxygen gauge that has to be when a newborn comes with us, saturation is 85%, and then after giving oxygen, it is again 98%. Whenever the oxygen is out, oxygen is omitted, then again 85%. That means the baby or the child is suffering from any type of family, mostly like this. According to the academic criteria, there is carbon right to the sun, and if the sun is there. They have to go and do it. Here, short term which pump the basically the permanent time they have to সম্পূর্ণ একটা প্রফেশন রাতে ইগো যাবে ইগো চলে আসে আর এই দিকে যাবে কমপ্লিট আসছে কম maybe this less then the perfusion will be less if this perfusion is less then what will happen extension will be less right v by q ratio will be v at the space में this is the v पूरा है Each, basic, right? Partition, basic. And d by q is the basic. Okay. And partition is the partition. D by q ratio is basic. But partition is not basic. Right? Do the gravity. One important was the second concentration. Previous slide first alveolar lower alveolar components digit components now here was protons in this way we have to think this pattern that total hypoxia is 0 proportional J was not there having considered the P by Q different hypoxia. Pulmonary edema and cerebral edema higher than এর পরে যদি আপনি টাইম হয় না এর পরে কিন্তু এই সি ব্যাক মানে নিচে জোরে চলে উপরে চলে গিয়ে দেখুন উপরে চলে গিয়ে আবার কি হচ্ছিল এনি হচ্ছিল সব হয়ে গেল accumulation ছাড়া accumulation means what changes for the benefit of the body accumulation means you are changing some system that is accumulated that is you want to overcome the side effects but if anybody is access fast then there is no chance of any such set of changes or accumulation and landing into the either acute mounted illness or is it death or cases that is higher altitude subacute and higher altitude pulmonary edema. At the level of the body complex edema and what? The idea is only 7 always increase पर क्या हो? और ये जब हम ये करते हैं ये वेलो ये वेलो पहले तो चले जब हम ये तो वहाँ आप ये जब हमने हाइड्रोसिस इंसुलिन फैक्टर बनाया it is obtained at the concentration of oxygen and since by the some immunoreactions that is myeloblasts. That is by interstitial cells of the kidney you can see. And that cells what? CO2 is this. So it ultimately forms this factor. For the discovery of this factor, huge effect of it. So HIV-1 is helps production of the erythropoietin. Erythropoietin means what? It will enhance the differentiation of the pluripotent stem cell or myeloid stem cell, and so the oxygen production will be high in case of body component sickness, and that causes the primary hemolysis and secondary hemolysis. This secondary hemolysis, primary hemolysis, let's check. These differences and what we are taking. So secondary percent we are having. So viscosity is increasing. Why is viscosity increasing? Say 1%. Right? ये resistance equal to 8 beta L 1.5 R to the power 9 So इनका क्या होता है? Viscosity. So viscosity will be high or low? High. If it is high, then मतलब है ratio is what? Then mountain, it will have a clear. It will have a clear. Basically, experience the walk through this level. Clear color, I got to tell the one. In ultimately, so chronic mountain sickness is the ultimate phase of hospital. তাদের কি করতে হয় আস্তে করে নিচে দিতে হবে তারপর এলোমিয়া সোয়েলিং acute mountain sickness cerebral edema হওয়ার আগে facial swelling দুটো কিছু আমাদের মধ্যে ওখানে গেলে facial swelling দুটো ফুলে that means patient is in the stage of when ultimately landed into cerebral edema সেটা যে mountain এর বুঝে যায় এই কারণে নামিয়ে আমার কি করতে হবে অক্সিজেন 100% oxygen, not 21%. You may be able to get 21% oxygen. You have to increase the value to monthly increase. If I open it, if I open the X, now we have kept to be also maximum is totally oxygen. That is normally in our transformer 21%. I already told that I am going to give you the patient is that 40%, 50%. Right? You have 100%. I was in the patient is the percentage of Pathophysiology, Pathophysiology, and language to the saturation is 75%. Quick from is foreigners. Our university level, something and here are the keys. About the so something you yourself, I will be playing a lot of I'm not going to do support in the line, but it is actually unfortunate. The patients have been negative on the team. Now, question is that for you, why can you support the team? Increase for this amount. You already know how our team becomes. It is because our future and natural research studies processes are known. In the meantime, bronchial arterioles are broken down by the pressure of the radium, and that comes as a key supplies coming. It is a deep characteristic sign of pulmonary disease. Whereas the root area of each body and by the abdomen, although there is a patient motivated and that after the disease. And X-ray was done, and X-ray pattern was like that bad thing data. That is clear pattern. That is also characteristic findings of the pulmonary edema. This is not just a simple whenever I give lecture on the pulmonary edema, Hypoxia, that is relevant for you. I am trying to show you it is there. So you can understand that how this evolution is very important in our stage, so that we can treat the patients and save the patients in the right way. And not the backward or the way. This is clear to the extent of that child that this family has a whiteness. To last exact phase, and it happens after the pneumonia. So pneumonia mixed, ultimately pneumonia mixed, pulmonary hypertension increase, then pulmonary hypertension, then develop pulmonary edema. ARDS, particular ARDS, acute respiratory distress strong, and insulin ARDS more or less 90%. 90% before that I will back to the face. That is missed in the patient bag, easily bag. Think for the discharge, that is a sign, clinical sign